Yeah. Yeah, so you're just having a talk about NDIS, and obviously with NDIS, they're talking about having a permanent disability, and you've got to be regarded as fully treated. And it's difficult to say, you know, what is fully treated? You know, is fully treated within the first 6 months? Is fully treated 10 years of treatment, or is it 3 weeks of treatment?
No, I think, well, you should try all the different treatments that are available for a patient, but we always look for that. Hey, did they have a sensible physiotherapist? Did they have a sensible psychologist?
Yeah.
A pain specialist, if that's pain
relevant.
is one of the issues, for example. And if all those things are ticked, then I think you can consider it a permanent condition.
Yeah.
And I know that it is very hard, and we also sometimes struggle with it because with NDIS, and again, I'm just a Dutchie here for a year in Australia, so I'm luckily don't have to bother with those institutions that much, but what I experience is that we can write the same letter for 2 patients.
Absolutely.
And one gets NDIS approval and the other one doesn't get it.
It is very much hit and miss.
Yeah.
And, you know, it's really tricky, you know, and some people get a good plan, some people get a bad plan. Being an occupational therapist, I see that a lot, doing all the NDIS reports, justifying why, you know, it's reasonable and necessary. It is really hard.
Absolutely. Sometimes I also have to say, when patients, for example, come to us and say, and we have their first meeting, and we tell them about the diagnosis, then sometimes already a question about NDIS pops up, and then we also honestly discuss with them, like, hey, we understand that this question is popping up already, but I think we still have a chance to work on it. And first should do that before we go into that trajectory. But if it's a permanent condition, it is a permanent condition. And there's also it is as much disabling as other neurological diseases are. And still, also work to do for us, probably, to get more data out there. But
okay. All right. And then in terms of the longer term management, so, you know, someone's diagnosed, they understand their condition, they've gone through that treatment. What does the longer term management look like? You know, if it's sort of fairly stable, but they're still, you know, symptomatic, still sort of fairly disabled, what is the role of the neurologist? Do they keep seeing the neurologist? Do they keep going to physio?
Some patients do, some patients don't. So that's not really an answer. I'm aware of that. What we do with our patients, for example, here in Brisbane, is that we, if we think that they had a proper treatment, for example, and they have a good understanding about the triggers, and have worked on some specific tools about what do they do when some symptoms flare up again, we discharge them, but also don't discharge them totally. So we always tell them, if you're one of our patients that we saw in the past, and something flares up in the future, just give us a call and then we book you back in. We have, and I think that's good. I know that the waiting lists are long, and but for the patients that we are seeing, we have a sort of, they always can come back to us, and they don't have to be referred again, for example, if we know them already and know what they've been going through. We have a sort of agreement with those patients that if you drop us an email, then we book you in somewhere.
Okay, cool. All right. Some of the other questions. One of the girls has talked about lesions on the brain. So she's saying, you know, lesions on the brain might be more common if you're older, but if you're a young person and getting these white matter lesions, she's saying, why is that considered incidental and not important for a young person who also has been diagnosed with FND?
I think those things can be very important. I think Look, having lesions on the scan, I think what I explained, like FND is more a software thing. So I don't think that the symptoms relate directly to those white matter lesions. But for example, if you have a vulnerable brain with software issues and you have lesions on your brain or another neurological disease, what I told you, like FND is very common in people who also suffer from other things, other structural abnormalities. So I think those things can be very important, but I think you should explain your patients that the specific symptoms why you diagnose with them with FND are maybe not related to that lesions, but the lesions can definitely have an influence about why they developed FND in the first place. So I think that's important, and it's not because, for example, there are some other neurological diseases, for example, strokes, that you can really see, hey, if you have a stroke in that area of the brain, you get those symptoms. And that really correlates pretty well. But always when we make an MRI scan, we see lots of things, and a lot of patients have white matter lesions, a lot of patients have other things that we see, and maybe that can contribute to the development of FND. But I don't think that they are causing the symptoms.
Okay, cool. And a lot of people, you probably know, they might get a diagnosis, so they might present to hospital. If they're lucky, they might get a piece of paper with or a discharge letter that says that they've got a functional disorder. In terms of a good diagnosis, often a lot of people are not actually given the diagnosis, so they actually find it in their discharge letter, and sometimes, months after being admitted to hospital. So people, are finding their diagnosis, they're not getting the explanation, they're not given advice. A lot of people sort of sent to the GP and the GP doesn't know what to do. What can a person do in that situation?
Yeah, it's a good question. And I think that's, again, showing that, well, the main problem is actually lying by the doctors and not by the, and then I mean the neurologist and the hospital
in the
hospital
doctors, totally.
and not by the GPs or physios or and definitely not at the patient side, of course. But I think, well, the website can be very helpful as a start, for example. But also, well, I hope that when we publish those recommendations about what can you do as a non-FND expert or in a rural part of Queensland, or as for example, what we have often is that we have physiotherapists who tell us like, hey, we see a patient with this and this, and we actually think that's FND, but hey, the patient doesn't have the diagnosis. Or it's not
I've had that question before.
Specifically for them, what are tricks, what are tools that they can use? And I think, yes, in an ideal world, we see every patient with FND, but I think there's still a lot of work that can be done already. Also, when you are waiting for a referral, so getting the word out now. I sound maybe really like a preacher, but getting more people that they at least know about FND, that it's not a strange word for them anymore, for GP. And that they know, hey, there are specific resources in Australia that we can use. For example, recommendation guideline. For example, FND Australia website, or there are many other FND websites as well. That would be helpful. But as I said, the problem lies with the doctors, I'm afraid. So that's why we do a lot of
sadly
teaching.
It is quite common.
Sorry,
sadly it is quite common.
People
saying they're just left to get on with it, they're not given help or referrals. And
I have to say, well, I did my neurology training in the Netherlands, and I didn't had a single course about FND before I became a neurologist.
Yeah.
But over the last years, I see that the interest is growing, and we try to, well, give some explanation also to medical students, also to physiotherapists. We sometimes do courses also in the rest of Australia. And what we see the interest is there, especially by allied health, but also more and more by neurologists. And I think compared to 20 years ago, and I'm not that old, but if I compare it to 20 years ago, what you see, what are the number of studies, for example, published in FND, how often do you hear about it at neurology congresses or movement disorder congresses, which actually is my keen interest. There's I think a good wave coming. But before everybody is trained properly, that will cost a couple of more years, of course, and a lot of work is still yet to be done. But I think the interest is there, and we see improvements already.
I would say that even over the last sort of 7 to 9 years, I've seen a lot more interest. And a lot more people knowing about, a lot more people wanting to know about it.
And for example, and that's not, but for me, for example, to do a fellowship specifically in FND overseas, that's something that you couldn't do 10 years ago. That is really, so that also maybe already shows that the interest also overseas is there, and to get more doctors involved.
And also more data, as you're talking about, with the cost benefit data.
Exactly.
That's what we really need in order to get government investment into FND and providing, specific services and, increasing allied health funding. In terms of Australia, we have like five allied health sessions under a Medicare chronic disease management plan, and that's completely inadequate to treat FND. That's not going to be regarded as treatment.
No, true.
In terms of your treatment program, I mean, like the allied health Medicare is 5 sessions. I mean, what would you regard as a reasonable consideration for physio in terms of duration or sessions?
Well, I think, and I agree with you that 5 sessions is probably not adequate at all. On the other hand, I think with a good, sensible physiotherapist, you sometimes really can see improvements even in 5 sessions already. And what our physiotherapists work with is the FND workbook, for example, and also, going over that with patients together. Okay, this is your FND workbook. Let's see what are your specific things that you can do that help you for preventing triggers, or so I think that's important as well. And what I think, and I know that is maybe very Brisbane specific, but what we do is every fortnight we have a morning session with the physiotherapist and with the psychologist about our FND patients. And we as neurologists are actually sitting in there and telling, hey, this is the patient. When was the patient diagnosed? What kind of treatment did he get? And also, and I think that's very important, that doctors and allied health work more together. It's not like, hey, I'm a neurologist, I made the diagnosis, I refer to you, now my work is done. But also stay involved. And maybe some patients after 5 physio sessions, that might be already enough, and they maybe need more psychological input, or maybe need just to know that, hey, there's still my neurologist there that I always can call, and my physiotherapist that maybe I got discharged, but I know I can still contact them if I have questions in the future. Or a simple email, for example, with, hey, what can I do? I think that's also a thing that COVID learned us, that there's a lot of things that we can do online, and that's maybe also interesting for the future about FND, because even our physiotherapist here in Brisbane, because you think, well, physiotherapy online, impossible. That's what I actually thought. That's actually very helpful in some patients.
Yeah. And in terms of being able to reach, that's one thing that we've done is we can reach all of Australia because we use telemedicine for our counselling and occupational therapy services. So it enables us to reach people who otherwise wouldn't get any care or treatment.
Exactly. And also, for example, just to show you another example, that what we sometimes see is if a patient is, for example, from Bundaberg or well, another northern Queensland city, they sometimes do telemedicine with their physiotherapist over there and our physiotherapist, and just having a meeting together, they connect. And sometimes the physiotherapist can have a couple of questions like, hey, what are the things that you do and well, keep that communication open. I think that's important.
Power of technology. Yeah, cool.
Yeah.
Well, thanks so much for your time and sharing your story and your research and your knowledge. It's been really helpful and good chatting to you. And
I hope my my accent was not too
good.
Annoying.
Yeah, not at all. Yeah, and I look forward to seeing your papers published.
Yeah, me too. And also if we get things published, and I'm pretty sure we do. We will also post the results, of course, on the website.
On the website,
so people can see it.
Yeah, that'd be great. We'll keep an eye on the website. Yeah, awesome. All right. Well, thank you for that.
Yeah, well, thanks for having me. Feel actually pretty special that I was invited to do a talk for FND Australia. So really enjoyed it.
Okay. Yeah, I did too. Okay. All right. Thanks so much.
Okay.
Bye.
Bye-bye.
Bye.